Hi, folks, and welcome to today's podcast, or today's webinar. Today, we're going to be talking about saunas, how saunas can improve your health. And this one is really interesting, actually, for a number of reasons. So, often when I hear people saying, you can improve your health with a sauna, you tend to go to the more superficial things, the more surface things that you would associate sauna use with, which is sweating, clearing things out of your system, just feeling a bit better, relaxation. So whenever you come across an article that talks about saunas being good and for relaxation and detoxification, just know that they're missing a massive paper that came out a couple of years ago, which was loosely referred to as the COOPIO, COOPIO heart study, or the Finnish sauna study, which showed significant reductions in cardiovascular risk and here's the key point, all-cause mortality dying from anything when you use a sauna, particularly when you use it more than 3 times a week. So let's jump into that now. By way of introduction, if you don't know me, hi and welcome to the channel. My name is Andy. I'm the clinical lead here at ReadyCare. If you are new to the channel, make sure to subscribe over here and click the bell notification on the other side so you get a notification when we go live. Today's session will be a quick one, maybe 10 to 12 minutes. And we leave it at that just for today. Okay, with that, this is the study I'm talking about. Now, let me just share this a little bit bigger. Okay, so this is the paper that came out, the Finnish heart study, going back a couple of years ago, that really demonstrated how important saunas are for overall health and also for all-cause mortality. So the paper is entitled "The Association Between Sauna Bathing and Fatal Cardiovascular and All-Cause Mortality Events." And you might think, well, how could it possibly impact on all-cause mortality? Even if it does have benefits for heart health, all-cause mortality means dying from anything prematurely. So from anything. So that means, cancer, anything that can kill you prematurely, So cancer, heart disease, Alzheimer's, Parkinson's, dementia, high blood pressure, stroke, everything, you name it. So I'm going to break down the results of this study. So basically what they did is they followed middle-aged men in Finland over 20 years. So the study went on for 20 years. The men were, I think it was 2,500 men aged around kind of 40 to 60 years of age in Finland. So if we look at the results here, so where I want you to look is down in the bottom where it says 1 time per week, 2 to 3 times per week, and 4 to 7 times per week. 1 time per week was used as a reference. So it's actually hard to find people who don't use a sauna once a week in Finland. It's part of their culture. So something like 85 or 90% of people in Finland will use a sauna more than twice a week. So it's very unusual to find people who don't use it once a week. But they ask people to use it once a week to have a reference. Now, what we're looking at here in the number, the 0.71 in the table that says sudden cardiac death, the 0.71 is what percentage of 100% risk were you at of dying from sudden cardiac death? If you took a sauna 2 to 3 times per week, you were at 0.7. So 0.7 of 1, we'll say. So basically what that means is that you had a 29%, almost a 30% reduced risk of dying from sudden cardiac death if you did 2 to 3 saunas per week. Now, I can't stress this enough. Major pharmaceutical companies would be doing backflips if you showed a 5% or 6% or even 2% reduction in sudden cardiac death over a number of years. They would say everyone needs to be on this drug. It would be a blockbuster drug and people would prescribe it left, right, and center. And I don't want to get into the conspiracy theory side of things, but there's drugs, including statins, which show far less efficacy than 1% or 2% and yet are the best-selling drug of all time. Now, if I was to say to you, I can put you into a box for half an hour, 20 minutes, 25 minutes, 3 or 4 times a week, and you'll enjoy it, and it won't be stressful, and it won't be painful at all. You'll actually relax in it, and it will reduce your risk of heart disease, fatal coronary heart disease, sudden cardiac death, and all-cause mortality, your chance of dying from anything, by 50%. Would you do it? You would. And if someone could say to you, if this is a make-believe, totally make-believe scenario, if someone said to me, if you give me 30 grand, 40 grand, 50 grand, I'll tell you a secret. I can give you something that will make you reduce your risk of heart disease and all-cause mortality, cancer, dementia, Alzheimer's, stroke, aneurysms, everything, by 50%. I would 100% pay it. You cut my risk in half of those things, for sure. That's a bigger effect than exercising and eating healthy put together. For sure, I would do it. So this little box can do it, going into a sauna. If you go into a sauna 4 to 7 times per week, it reduces your risk of sudden cardiac death by 50%, fatal coronary heart disease by more than that, cardiovascular disease by more than that, and all-cause mortality by 39%, nearly 40%, which is incredible, absolutely incredible. Now, over on the right-hand side, what this showed is the duration per session and the related risk reduction in all of those different sections. So if you sauned for less than 11 minutes, the risk reduction was minimal. If you sauned for 11 to 19 minutes, you were starting to get up there. And if you had a reduction if you did saunas for longer than 19 minutes, that's where the kind of sweet spot was. So if we look at what saunas do, and this is really interesting, saunas stress you. They put your body under stress. Now, I've had someone say to me before, well, saunas can't be good for you because they increase your heart rate, and that's bad, and they increase your blood pressure, and that's bad. So exercise does the same thing, by the way. So we would never make the assertion that exercise is bad for you. Exercise increases your heart rate, increases your blood pressure, puts stress on your body, reduces your ability to breathe, all those things, increases your stroke volume. Everything goes up. Everything goes in the wrong direction while you're exercising. But your body's adaptive response to that is to make those systems stronger. And the same thing happens with sauna. In fact, there's a really close kind of comparison between the two, or things that they have in common. In that saunas can be considered an exercise mimetic. And by mimetic, I mean it mimics the physiological responses that we see in exercise. There's some incredible studies done over the last couple of years where they get athletes to exercise 3 times per week, and then they get the same athletes at week 4, 5, and 6 to stop exercising and do saunas instead, 3 times a week. Instead of the 30 minutes of exercise Tuesday, Thursday, and Friday, they do saunas Tuesday, Thursday, and Friday. And there's no difference in their performance. So it keeps up a lot of the same benefits. So saunas are an exercise mimetic, which makes them a really interesting tool for people who can't exercise or have mobility issues. So in order to understand what saunas do, we must understand the principle known as hormesis. So hormesis is it's something that stresses the body in the short term. And if you were to do it for too long, would definitely be bad for you. So let me give you an example. If you exercise for 60 minutes 3 times a week, that's going to be really good for you. Now, if you run for 60 minutes 3 times a week, but you're not fit, that's going to be really bad for you. You might keel over, you might have a heart attack. If you exercise for 75, 80 minutes and you're fit, if you do a 10K or if you do a half marathon, that's going to be really good for you. If you do an Ironman and you do it every weekend or every couple of days, your body will eventually break down and you'll die. You can't do these things indefinitely. Alcohol is another interesting hormetic stressor. Glass of wine with your dinner provides antioxidant effects. It stresses the body at a very small level and your body has an adaptive response to it. But if you're having 4 bottles of wine with your dinner every night, you'll eventually die from it. Your liver will pack up. So hormesis is something that provides a beneficial dose in small amounts, albeit through an adaptive response because it stresses your body. And if you go over and above a certain dose, it will eventually kill you. It could be toxic. So a sauna, for example, you couldn't stay in a sauna for 10 hours, you'd die. Same thing with exercise, same thing with stress, same thing with intermittent fasting, caloric restriction. Caloric restriction is really, really good for you. Intermittent fasting is really, really good for you. It brings along a whole host of physiological adaptations that make you much healthier, but do it for too long and you'll waste away and die. So again, same thing. So that's known as hormesis. So the idea that something raises your blood pressure, makes you breathe faster, makes it hard to breathe, that is a bad thing, is totally incorrect. And there's nothing more obvious there as a way of explaining that than exercise. So it's something that stresses your body in the short term, and the beneficial dose is just up to a certain point. So same thing happens with saunas. So what are saunas doing? What stress are they putting on the body? Well, they're redistributing blood. That's one of the most important things. So if you have, for example, poor wound healing or clots or anything like that starting to happen in your body, blood redistribution is a really good thing. Getting the blood pumping around the body. You know, we know that you should warm up before exercise for that reason. We know that if you're trying to prevent a blood clot now after surgery, the newer kind of guidelines will actually say, get up and exercise as soon as you can. Get up and move around as soon as you can. Don't stay bedbound. Staying bedbound, if you can help it, obviously, it's, it's not a good thing if you can't help it. That's, you have to do what you can. But if you can, get up and exercise. So I know my wife had an operation a couple of years ago over in Poland, and they had said to her, as soon as you can, it was an operation on her legs, vascular stuff. And as soon as you can, get up and exercise and get around. Even with the pain that she was in, get up and walk around the ward as often as you can. Whereas the old idea would have been bed rest to allow the body to heal. So what it does is it raises your core body temperature. And the raising of the core body temperature is interesting because it causes the body to produce what are known as HSPs, heat shock proteins. And these heat shock proteins reduce protein aggregation, increase protein sparing, and basically reduce DNA damage. So they're really, really beneficial to the body. It also produces an anti-inflammatory effect through what are known as anti-inflammatory cytokines. You'll have heard of cytokines if you're clued into the sort of ins and outs of coronavirus, because pro-inflammatory cytokines are what the coronavirus produced, COVID-19 produced. So core body temperature goes up, you sweat, there's a detoxification through that. I would say it annoys me actually when people say sauna is a good for you because you sweat toxins out of you. That is probably the least impressive thing that saunas do. It's just one of those marginal benefits, and they do. You'll get rid of like mercury and aluminum and various different toxins that build up in the body otherwise. But it's a marginal benefit. The blood redistribution, the exercise mimetic effect, the core temperature going up, increased cardiac output, so your heart is working harder, stability in your stroke volume, increasing in your heart rate. These are all massively important, and most of the mechanisms actually are shared with exercise. So consider yourself essentially exercising when you're in a sauna, which is incredible. So here are some of the effects that we see in the literature, what actually happens when you look at the ins and outs of what saunas do. So first of all, they lower your total cholesterol. Now, I'm not all that concerned about lowering one's total cholesterol. I am interested to see HDLC going up. That's your good cholesterol. So good cholesterol going up is important. Inflammation going down is important. Now, again, in the short term, you could argue that saunas increase inflammation, but your body's response to that is to reduce inflammation. You get a reduction in something known as ROS, which is reactive oxygen species. Reactive oxygen species increase inflammation, so we want those to go down. Your arterial stiffness goes down. Makes sense because you're bouncing or pounding blood around the body, your blood pressure is going up like it does in exercise, and in short amounts, that's a good thing. So this goes back to what we were talking about here in hormesis. So your blood pressure going up is actually very useful if you do it in an acute and not chronic manner. So what do I mean by that? I mean acute, short-term increases for short periods, and your body has a response to that to make sure it doesn't happen again. Chronic is long-term and progressive. If your blood pressure is always high, that's a really bad thing. That's going to wear on the blood vessels and cause endothelial damage to the lining of your blood vessels. So arterial stiffness goes down. So the stiffness of your arteries, so they become more flexible, which is obviously a good thing. Arterial compliance goes up. Your arteries' ability to comply with your blood pressure going up goes up. And intima media thickness goes down. So basically the thickness in the intima, the inner lining of your arteries. Cardio function goes up, so you get fitter. Immune system response goes up, and your blood pressure goes down. So if we look at what happens here, inflammation goes down, cholesterol levels get better, good cholesterol goes up, blood pressure goes up, your immune system gets stronger, and you get fitter. So really, really impressive stuff. So let's just finish up by looking at roughly what reductions do we see in saunas. If you use the sauna 4 to 7 times a week, at least 15 minutes, so the actual number there, this is from a newspaper cutout, the actual number is about 20 minutes. So if you want to go about 19 or 20 minutes, as hot as you can tolerate, but don't go too hot too quick. I remember we have a sauna downstairs, and I remember getting into the sauna and going to what would this be, 175, 180 degrees straight off the bat, and I couldn't stick it. I'd get about 12 or 13 minutes in, I couldn't stick it. And now I'll I wouldn't say comfortably. I'll comfortably get through the first 15 minutes, but I'll comfortably do a 40-minute sauna 3 times a week. at the highest temperature I can get to. So you do have to build it up, no different than exercise. If you use a sauna 4 to 7 times a week for 15 minutes, let's call it 20, which is the actual number, you're 66% less likely to have dementia or Alzheimer's. You are 65% less likely to suffer a brain stroke. You're 51% less likely to die from cardiovascular death. Interesting phraseology, to have cardiovascular death, but to die from heart disease. And then 83% of people report better sleep, which makes perfect sense, of course, because you're essentially exercising. Like I said, it's an exercise mimetic. And then patients with asthma, chronic pulmonary disease, and pneumonia get much better as well. So if there is something that you wanted to do to increase your overall longevity and actually see a host of benefits to your overall health, that would be it for me. That would be the thing that I would be doing. So, guys, thanks so much for taking the time to join us. Don't forget to like and subscribe to this video. It helps us out more than you'd think. And we'll see you soon. Take care. Bye-bye.